I thank the gentleman. I'm reminded of a Teddy Roosevelt quote. He said, "It's not the critic who counts, but the man in the arena." Thank you for being in the arena during this difficult time for our country and the world. I'd now like to yield to Ranking Member Ruiz for a closing statement, if he would like one.
Thank you. I, too, want to pause and remember the millions of people who died due to the pandemic and their families who mourn, including some of the members that sit up on this dais who lost their families, members in the audience, perhaps even our expert witnesses and staff who are here. It's very important that we keep front and center and remember them always. When the COVID-19 pandemic hit, it gripped our nation with uncertainty. We knew little about this novel virus, about the way it spread, the danger it posed, and the damage it would inflict on our communities. But it was during this time of significant uncertainty, one thing became increasingly clear. Our nation was not where it needed to be when it came to pandemic preparedness and response. But with rapid and sustained deployment of COVID-19 vaccines and therapeutics and robust public health investments in the American Rescue Plan, we left the darkest days of the pandemic behind us. This is thanks in large part to the dedicated and hardworking members of our nation's health agencies. I want to offer my thanks again to our witnesses here today representing some of those agencies and sharing with us the tireless work they are doing to prevent and prepare for the next pandemic. I'm going to make it very clear to the scientists who never wanted to delve into politics, who went pre-med and not political science. I want to send a message to the lab technicians that work in your agencies. I want to send a message to the administrators who day in and day out want to do the right thing for the mission that your agencies pose. I want to say thank you. You are not the enemy, and you should never be demonized. That your work is valuable, your work is appreciated, and your work is what is keeping our country safe. And there will be help, and there will be recognition of that work, and there will be a positive way forward from this. So hang tight, buckle up, believe in your work, know that you are appreciated by millions of people in this country, regardless of the demonizations and the disinformation that's out there and the misinformation that's out there. You're doing good work. So I want to thank you and know that keep your integrity, keep your character, and do the right thing. We have seen and investigated individuals here that veered from doing the right thing, and that is not acceptable. So what you're doing in doing the right thing, being transparent and open, is what's going to help us through to the next pandemic. So, and that is why this is thanks of what we've been able to accomplish in large part to the dedicated and hardworking members of our nation's health agencies. And I want to offer my thanks again to our witnesses here today representing some of those agencies and sharing with us the tireless work that they are doing to prevent and prepare for the next pandemic. Last Congress, Democrats led the House in taking meaningful steps toward bolstering our pandemic preparedness and response capabilities with passage of the Consolidated Appropriations Act of 2023. Included in this law were bipartisan provisions from the Prevent Pandemics Act, which made several significant reforms to help ensure we are better prepared when a future pandemic strikes. These reforms acted to advance our nation's biosafety and biosecurity, revitalize our public health workforce, prevent undue foreign influence in biomedical research, and enhance our strategic national stockpile. We didn't focus on these during these last 2 years. We didn't really have a conversation about the positive work that has resulted from that, from these laws from last Congress and how they're being implemented. We didn't dive into the positive things that we learn from the lessons learned. So I just really want to highlight them there, that there is a whole other section of actual work that's being done, and that there still needs to be oversight. There still needs to be collaboration. There still needs to be a discussion of all those changes so that we can make sure it moves in that right direction, and in fact, that we keep them, given all the recent threats that we've heard today. Because ultimately, these policies have charted the course of a more efficient, streamlined pandemic response for the future, and they have shown that we can do what we can do when we come together constructively to protect Americans' health and save lives. And we must work to continue these efforts to strengthen our supply chains, develop new vaccines, and stay on the cutting edge with advanced therapeutics. And as an emergency physician and a public health expert, developing forward-looking solutions that help our nation better prevent and prepare for future public health crises continues to be my top priority. So I hope that today's hearing serves as a reminder of the important work that our federal health agencies do for the American public. It's imperfect, but it's important, and the results have shown for itself since we are no longer in the throes of this pandemic. And that Congress will continue to support this work rather than manufacturing distrust or throwing conspiratorial accusations in our safety systems and public health as a whole. And before I end, I know we'll have another session, but I'm going to take advantage here and thank this hell of a guy, Mal Lichtman, the director on the Democratic staff team, Alicia Yates, Danny Walker, and Joseph Romero, who have done incredible work, who I'm extremely proud of, who have only made me a better person and a better leader, and have done extremely, extremely important work for the American people. I want to thank you all individually, and I also want to thank the Republican staff. I have seen firsthand the dedication during some of our travels and work that we've done. I know your heart's in the right place. Thank you. I yield back.